Okay, welcome back to Better Health coverage here at we're live here at HIMSS 10, and we have John here for Informatics Corporation of America (ICA). I hope I got that right.
That's correct.
So, for people who may not be that familiar with ICA, why don't you tell us a little bit about that?
Okay. Well, ICA was formed about 5 years ago to take the technology that was developed at Vanderbilt University Medical Center for the past 17 years out to the broader healthcare market. And what we do is we provide an interoperability infrastructure for the exchange of healthcare information, and then a portal and also workflow tools for physicians, nurses, other practitioners to be able to use the information that's collected from legacy systems that are already in place and have one common portal to use that information at the point of care.
Oh wow, so probably at Vanderbilt, I would think there'd be a lot of legacy systems there to try to integrate.
Yes, Vanderbilt has 4 separate hospitals, and they have about 3,200 physicians that practice within the Nashville area, and all of them were using that technology and brought all of their specialty systems, their legacy HIS systems together, and they use that as their main source of information when they're treating patients.
So would this be for mainly type of like clinical information or other type of information?
It is all clinical information. So we provide a longitudinal patient record with all of their information, has their lab, radiology, also has dynamic links out to radiology systems. So if they're looking at a particular result, then they can click on a link and it actually links out to that image, and they use a diagnostic viewer so that it doesn't interrupt their workflow. Once they get out of that, then they're back within their workflow of what they were looking for. What we found is a lot of physicians, when they start getting into systems, they're chasing rabbits. They get down there and find the rabbit, and they don't know where they were starting from. So this enables them to very quickly get back into the workflow that they were in. And it has increased physician adoption tremendously within our clients to be able to have a physician-developed portal that we're taking out to the market.
Wow. So if I understand this correctly, and you can correct me if I'm wrong, so kind of bridging the gap between like legacy like databases and bridging the gap towards whatever the current EHR, EMR system that the hospital is using now. Do I understand that correctly? Or
Well, what we do is we take, of course, hospitals usually have a hospital information system. They usually have lab components of that. They may have a cardiology system that's separate. And of course, most hospitals have a lot of physicians that refer into that hospital, and they need the inpatient information or the acute information or the emergency room information. Most of them get some of their labs done at that hospital. And each one of them usually has an independent system as well. They either have eClinicalWorks or NextGen or Sage or one of those. Right. So we tie all of those together so that they can share that information and be able to have a full view of patient information for the patients that they're seeing.
Oh, okay. So the information that they're seeing is on their product, or is it on the kind of ICA type of product?
Both. We can either, in our interoperability engine, we can either translate the information so that one source system can consume that in the other, but we also multi-purpose that by collecting it and putting it in a portal. So those physicians who may not have an emergency or an EMR or an EHR, then they have the portal that they can use as their primary source of viewing that information. Within our hospital clients, we find that the physicians use our portal as their primary source, and then when they get back into their practice where they may have an EMR, it's a secondary source of information.
Oh, okay. So if because I'm a family practice doc and I have an ambulatory practice, so if I would be looking for information from the hospital, I would be able to access that and maybe dump that information into my office EMR?
Yes, as long as your office EMR can consume a standard set of data and then display that back to you. And we do that with a lot of EMRs.
Wow. So how do you guys do that? That has to be a lot of different interfaces, and that has to be very, very complicated. Do you guys initiate that, or do you depend on whoever the other vendor is to initiate that interface?
Actually, what we do is we have a very flexible engine, and we take whatever they can give us, and then we, for instance, we go all the way from capturing information from a print spooler, and then forming that information and having it display back to a physician within our portal, all the way to transmitting CCR CCDs back and forth. So we can get discrete data, we can take unstructured data, PDFs, Word files, transcription files, and we put that all in. We attach what's called meta tags to that, so that it's categorized correctly, so you know you're looking at a radiology result, or you're looking at a laboratory result, or a path report, and then we categorize that within our database so that it displays in a longitudinal, something that's very easy for the physician to use and find.
Oh, great, great. Kind of one of the buzzwords I'm hearing here this week is mobile, mobile, mobile. That you guys offer solutions as far as for the mobile doctor who is looking to access information from their mobile device.
We actually send alerts to mobile devices. What we've found is most physicians, and what we try and do is allow them to consume a lot of information within a single page. So we do send alerts to mobile devices for them to go back to the portal. But as far as the portal, we, generally speaking, you can use a notepad, but if anything smaller than that, it's very difficult to maneuver around.
So what kind of alerts would they be? Would they be regards to things like lab tests or other types of information?
Anything that's out of the normal. And what we find with most clients is those alerts, they want everything alerted, and then as they implement it, the doctors are saying, stop inundating me with all these alerts. So we narrow it down from there. So